I hope you're all happy today. The weather in DC has become better for the last 2 days. Thank you, Max, for the opportunity to return to the DC Summit. I'm here today to share that we delivered on promises we made last year to our care teams and our community. We are now the world's first health system to implement Epic electronic health record environment fully in the cloud, in the AWS Cloud. But we did not stop there. We built an entire foundation that includes 42 additional integrated applications. That includes our most critical applications from Infor, 3M, Highland, Philips, GE. For our patients and consumers, we built a multilingual, omni-channel app that they can use to access care where and how they want it. Supporting this access, we also built chatbots and a contact center with AWS Connect. But before we go how we pulled this off in 14 months, I want to share a little bit about Tufts Medicine, where I work now. We are an integrated delivery network with more than 225 years of experience, over 16,000 caregivers, and 2,400 physicians deliver care at an academic medical center, 4 community hospitals, and the largest home health network in Greater Boston area and the Eastern Massachusetts. We are focused on improving the health of our community. In 14 months, we have implemented the foundation for an entire digital healthcare environment. Okay, so let me share how we did this. We started with the 4 core tenets. Number 1, enable frictionless patient and consumer care. Number 2, deliver a joyful provider experience. 3, ensure optimized operations, infrastructure, and cybersecurity. Establish a cloud center of excellence. To succeed with healthcare transformation in the cloud, we had to be mindful of all these elements. So what do you mean by frictionless care? Our goal was to remove the barriers for patients and consumers to access the healthcare they need, whenever they need it, however they need it. We are making it easier and simpler for patients and consumers to access care. Everything from registering, finding an available appointment, connecting for remote care, accessing results, and accessing social services. But on top of it, it's available today in English, in Spanish, and in Mandarin, because we serve those type of communities where those languages are spoken. In a single app, we have gone from 106 portals to a single app called My Tufts Med. Very shortly, with the assistance of AWS, we'll be adding 7 additional languages. What do we mean by joyful provider experience? The implementation had few bumps, maybe a little bit more than few bumps. But as a CIO, you're very used to dealing with complaints, trouble, tickets, etc., etc. Instead, our executives, our physicians, our nursing leaders are expressing their delight, because now physicians, caregivers are able to finally access not only the electronic health record, but all the information they need. Because of the architecture we designed with Epic and AWS, it's lightning fast. Believe me, sub-millisecond. Whether they access it from the hospital or the clinic or home. Let me also share what we meant by optimizing operations and infrastructure and cybersecurity. We did this project in 14 months. It's something that would have taken 3 years in traditional data center environment. My Chief Modernization Officer, Jeremy Marut, who's sitting here, took what would have been a 6-month hardware procurement process and compressed the initial build to 4 weeks. 4 weeks, not 6 months. Now, with the help of ProServe, we can spin up an environment in less than 6 minutes. I'll give one example. We needed to ingest document images for 4 million patients. We were told by the software vendor this would take 200 days. We spun up additional capacity, completed the job in 72 hours, then we spun it down. Wow. Security is critical. As part of this implementation, we made sure everything was encrypted, both in motion and at rest. It's amazing how many legacy applications were not enabling these best practices. Finally, having a cloud center of excellence was critical. I'm sharing this so that others who venture on this may find this useful. We work closely with our partners, Epic, AWS, and others, to set up the Cloud Center of Excellence. It includes AWS, Epic, and other partner training and certification, architecture which has to be validated by Epic, AWS, and our team, a collaboratory where our partners are incentivized to modernize their application architect and cloud enable their support organization. I trained as a surgeon. In surgery, we talk about learning process of see one, do one, and teach one. We're applying these methodology for our IT professionals. ProServe helped us set up the environment. We asked managed services to monitor the environment for the first year. This gave our IT shop to build the expertise to build fully operate our cloud environment. Well, let me share what we plan to do in the next 12 months. We have built the foundation where we have built several elements of transformation and will be doing more. We have already started to rationalize our portfolio of 800 additional applications and migrate the consolidated portfolio to AWS. This will save us tens of millions of dollars a year. Second, we are going to enhance patient and provider experience. We'll add 7 more languages that are spoken in our community we serve. We want to ensure access for all our patients. We're going to introduce a virtual pharmacy, and finally, we'll provide 2,000 independent physicians work in our community if they want access to our EHR. We also have a large data lakehouse, and will now focus on predictive analytics, machine learning, AI to provide insight, predict, and prevent disease, and provide precision therapies to patients. Finally, we'll take on another challenge, medical imaging. We have 3 PACS systems today, and we'll start the process of moving our medical images, radiology, cardiology, oncology, pathology, and dermatology into a single system, and we'll use ML and AI to help us. Our goal at Tufts Medicine is not only to redefine healthcare, but to reinvent it, reinvent the way it is delivered. I want to thank AWS for the partnership and for allowing me to share our digital transformation journey at Tufts Medicine.